to the session Transforming Healthcare Benefits from a Future-Looking Lab, where we will be looking at the need to build future-ready labs. I will now call on our first speaker, Mr. Jay Nam, APAC Value Creation Consulting Manager, Abbott Laboratories, to share on the value of labs. Mr. Nam, please.
Thank you, Cindy. Before I jump into my presentations today, I just want to bring your attention to the subject today first. So opportunity to restate the laboratories. And also we have mentions in here about the future of our lab in our introduction sessions as well. However, it's not about the sci-fi movie style of laboratory, of course not, because we believe that we are on the very right time to copy the opportunity to prepare the future of your lab size. On that point, let me propose to you upfront benefits to phrase first. So that phrase, you see here is from our lexicons, because this is a very commonly used phrase, which was why I think matters. First, on the left-hand side, new normal. I know you probably think of that phrase at this point, but we all use it, right? We also can see that a lot of sessions in HML, we don't. Here is why I don't like it. It suggests pictures somehow fixed returns. And this is why we think about the pictures. But our main responsibility as healthcare leaders is to figure out how to adapt to prefixed reality in emerging things cannot be changed. So these was terms I've heard all times from you and the many people from the healthcare sector in early months of pandemics. Over time, in the more and more healthcare executive and any official leaders in healthcare sectors, they are speak to gravity toward to the right-hand side, so which is a recovery phase. So the longer pandemic period that I know horrible mortality rate in the Asia Pacific years and also around the world, and more exhausted we became. So more attractive pre-pandemic norms, which is start to look. So in this words, your main ambition is to accelerate and also facilitate the return to the old days, that recovery process. However, I personally don't think either of these are helpful. So because the both of these cast you essentially as passive or still in the very reactive. They assume like future is already set. So as long as those questions are truly unanswered. So the future is not just unknown, right? So it is still unwritten. So that's why we can influence futures to change continuously. Therefore, the questions we should ask ourselves, the box in the below lies, what do we want our futures to be? So because we are in the course of a third phase of pandemic now. So if I return to the word terminologies, so phase one is mobilizations, of course. So there was an immense amount of fears and uncertainty, and also the misgivings we have. And there was also a lot of focus on energy and enthusiasm around what needed to be done. After a few months, we had a new norms as a new normal. So phase two is basically war on the COVID pandemic drag on. The initial enthusiasm wore off, and we got exhausted and traumatized, and we set our sight in the every recovery phases. So phase three, that is a recalibration and resolutions. So which is of course where we are all right now. So this is we must decide what pictures are going to look like. So what's that picture resemble pre-pandemic reality? So diverse from the insignificantly or whole somewhere between those two things is again, of course, in the ultimate way up to us. So once we pick how we can set our baselines in the page three, this is might be a very heavily impact our post-COVID. So that is why we have to take a look at this window. However, this window of opportunity is very narrow. The healthcare industry is now state of fluctuations, such as long-standing utilization patterns and long-held regulations by governments, and consumers' preference also have heavily changes. And also all kind of windows are also impacted by a lot of things during a COVID pandemic. So this is reasons why we think this is a very right moment to build up our strategy for healthcare sector, even healthcare industry from the scratch. Good news is that I think that we already know about what is a major point of interactions. So we think that there are 6 interactions points that deserve your particular attentions. So all 6 interaction in here is all issues that have potentials to play out, directionally. So I should say directionally difference, but also not just the incrementally difference either. So there is a time limit of window, so opportunity to save the trajectory of such a 6 interactions points. And also these are all things as a healthcare reader, as like you, I think meaningfully inflect. And also we read it that in the futures will have a consequence that cut across the multiple healthcare sector and also all sector in the healthcare industry either. We also have implications of this kind of a shift significantly. The fact that we have an opportunity to save the future of virtual care in years, and also pro-outcome minority majority to impact to the health equity. So this is also one of the hottest word in now in the home-based cares as well. So on that point, we have since impressions impact to the healthcare sector and the hospitals. What is the response related to the laboratory size from the hospital point of view? So there is a reasons why I have a bring the one of a study in here in listening one of healthcare reader survey outcomes, which was happened on 2020 last year. So the question is that how their outlook on the lab strategy in terms of a post-COVID situations. So left-hand side. So left-hand side, in the around 50% of hospitals leaders view their lab as a strategic asset, whether it is profitable or not. And the other 27% view their lab as an alternative revenue stream focused on the generating profit. Another 24% just take a look at the view as a lab as a commodity. Interestingly, regardless of hospital leaders' overall strategy stance towards their clinical lab, most of conversion on 2 key objectives for their lab. So as I highlight on the right side of the slides. So first thing is that using the lab to reduce unwarranted clinical variation. So this is more about the quality side, right? The other second thing is that increasing the lab profitability and operational efficiency, more efficiency, excellence side in the lab side. So in some cases, the reader's strategic stance isn't directly related to the lab objective. So for example, leaders who view lab as alternative revenue streams are more focused on the expanding their outreach program than those who view lab as commoditized services. On that point, we believe that there are many things we need to align between the hospital strategy and the lab objective, and also vice versa. So in order to achieve it, the healthcare transformations, basically prepare for the cost of COVID-19. So how we can make it to prepare such a well prepared for the lab in the future? So that's the reasons we have a bring 5 opportunity to improve future of the lab. So go along with the healthcare transformations to prepare in the calibration phase of COVID pandemics. First is that to establish the formal business process in order to identify the strategy and also align the laboratory strategy with the hospital goal. So this is an area we normally easy to neglect at the hospital management point of view, since we have a perceived as a lab as a cost center instead of a device in analytical center. If we have considering over 60 and 70% of diagnosis of patients which is coming from the lab, so in that case, this is very important. We have to take a look at the lab as one of the areas we needed to improve it from the hospital point of view. The second thing is that looking for the opportunity to expand the business model, so such as an outreach program and also a lot of different type of tests, POC or home test, the molecular and the gene test. But on top of that, if we have a look at patient segmentized This is a kind of a way to look at the business model to expanding. The third thing is that need to establish the adopt the lab operations according to the diagnostic optimization design. This is more about the efficiency wise, but at the same time, we also take a look at the profitability improvements as well through the total value of ownership analysis, and also in the, such as in-depth investigations on the your profit process as well. First is how we can control data, so clinical translations, how we can translate it, lab data to the clinical departments, and also how we can communicate with the data with the clinical departments, and also how we can establish this data deposit infrastructure approaches, such as clinical disease support and also big data management as well. This is also areas as a lab point of view to improve it for the future one. Last but least, develop health creations competency. So this is more in order to build up the healthcare community to leveraging the lab data. So such as to managing the population health management by the chronic disease care, and also how we can combining the lab data into the integrate to deliver the integrated care at the hospitals. So these are 5 things maybe we have to take a look at as a 5 opportunity to improve it and also prepare for the future one. On today, we bring one case study, which is related to the how to build up the strategy through the business process transformations. As the next sessions, sales from the design hospitals, we're going to share about this one. Thank you.
Thank you, Mr. Nam. It was interesting to hear how hospitals can strengthen lab capabilities to prepare for the future. I'll now invite Mr. Hyun Lee, Chief Strategy Officer of South Korea's Design Hospital, to share with us his experience with future labs. Mr. Lee, please.
Hello, my name is Hyun, and I'm the Chief Strategy Officer of Design Hospital located in South Korea. The main message that I'd like to deliver today is that investing in the lab to make it smarter and more efficient can really benefit the hospital, and that to build a smarter and more efficient lab, you need a multidisciplinary and holistic approach, starting with the future direction of the hospital. So let me first introduce my hospital and tell you a little about myself. And then I'd like to share my story on how I worked with Abbott to improve the lab at my hospital and how that's helped my hospital in return. So about Design Hospital. Design Hospital is located in Jeonju City. It's the provincial capital of the North Jeolla province in South Korea. Some of you in the audience might have been to the city because it's a very famous tourist destination known for traditional houses called Hanok. Design Hospital has a very short history. It is only 10 years old. It was founded in 2012 as a 200-bed rehabilitation hospital. And it's grown really fast over the past 10 years. And it is now a 530-bed general surgical facility. The campus, because it spread out, because it grew so fast, the hospital is spread out over many buildings, and the hospital campus currently consists of 13 buildings. So that's about Design Hospital and about myself. So I'd like to begin by saying that I'm not an expert or authority in any way in hospital management, let alone running a lab, because I come from a legal background. I used to be an attorney specializing in mergers and acquisitions, and I hold the title that I hold now because it's a family business. Um, so I do not have much experience or expertise about running a lab. What I do have, however, I think, is a fresh set of eyes at looking at what kind of role a lab can play in a hospital. So let me share my story now about working with Abbott. I first met with Abbott 2 years ago as a vendor and customer when my hospital was trying to replace the outdated immunoassay equipment. My hospital also uses other vendors such as Hitachi, Roche, Siemens, whatnot. And naturally, when I first met with Abbott, my focus was on reducing reagent prices so that I could keep the costs down. But my experience with Abbott has turned out to be much more and more significant, more helpful than just reducing reagent costs. Because there were some unique challenges that my hospital lab was facing at the time. If you remember, Design Hospital grew really fast over the past 10 years, from a 200-bed hospital to a 530-bed hospital, from a rehab hospital to a general surgical facility. If you really think about it, that means we are adding 50 new beds a year. 10 to 20 new doctors are joining the hospital each year. We are getting a few new specialties each year. We're getting 50 to 100 new employees each year. We now have something close to 1,300 employees. And if you think about the challenges that kind of change brings on a lab, it is quite daunting. There are new kinds of tests that the lab is having to run each year. Not just each year, probably each quarter. We were constantly having to bring in new equipment. And the space was continuously getting smaller because it was too overcrowded. And the staff was too undertrained. And by undertrained, I mean they were undertrained in the sense that they were not used to running all the tests that they were having to run. And I explained before that our hospital campus is spread out over 13 buildings. And what that means is that transport and handling of samples can also be a problem. There's a lot of ground to cover, and I've had to move the lab twice within the past 4 years I worked at the hospital. And if anyone's ever been in charge of having to move a lab, it is a nightmare. By my count, I think we had to work with 20-some vendors to really make it happen. And that is without the operation stopping at any moment. So why was working with Abbott different from working with other vendors? How was it more than just cutting reagent prices down? But the challenges that I just talked about associated with my own lab, Abbott was willing to sort of sit with me and work over them together. And with that, I'm going to show you the next slide. Okay, so Abbott has this program called Abbott Transformation System. We didn't really sit at a table and say, oh, let's follow this ATS approach and talk about how we are going to improve the lab. But we did it more in a more casual way, but this was in essence what Abbott was doing with me. And we start going into details. We start going into detail. It is essentially a process by which we assess where we are now, where my hospital is at now, and where we want to be headed, and what the lab or how the lab can change so that it can help the hospital get where we want to get. So in essence, so let me show you a few slides that can help you understand the sort of things that we discussed with Abbott. So we talked about the macro and micro trends that were taking place in the healthcare industry in South Korea. And this was in order, this was necessary because we needed to, because understanding the bigger picture was an essential part of setting the objective, the long run objective for the hospital. Additionally, we did a survey on what the hospital perceived as where we were in terms of operational and clinical care excellence, and we did a survey on what our perceived level was and what the real level was by asking our patients and our in-house staff. We surveyed our competitive landscape. We identified our local competitors, regional competitors, and national competitors, and did an assessment on what our relative strengths and weaknesses were. These national competitors are not competitors per se, because they're much larger hospitals than Design Hospital. They're multiple thousand bed hospitals, but they're also competitors in a way because sometimes our patients will opt to choose to go to those hospitals instead of our hospitals instead of the Design Hospital, when Design Hospital was more than perfectly capable of giving the care they needed. So this exercise was also very helpful. This again has to do with our setting our goals and what strategies we'd like to implement to attain those goals, and what tactics would be more helpful in particular. We talked about who our external and internal stakeholders were and what their needs were. These are all examples that I'm giving of the preparation work that I did with Abbott in order to determine where we want the hospital to go to, and what the lab, how the lab could change in order for the hospital to get there. Key performance indexes. So let me skip a few slides and sort of get to the point, because I'm starting to feel like I might lose the attention of some of you. So in the end, all this effort was culminated in this result. On the vertical side, we have, sorry, the resolution is not very good, so I need to look at my paper slides. So yeah, on the vertical scale, we have effect, and on the horizontal scale, we have effort. So we identified short-run, mid-run, long-run projects that we would need to engage in, depending on how much effect it would produce, given the amount of effort that we put in. So obviously, you would want to start with the projects that would require the minimum effort, yet with the most effect. And then you would put the, you would sort of want to push off on the projects that would have the least effect, yet require the most effort. So some of the projects, so some of these projects include, for instance, introducing analyzers with small footprint with higher uptime, because like I explained, our lab is very overcrowded. Ways to reduce rerun, standardization of lab processes, introduction of the automated track system, and ultimately one day, relocation of the lab. So, there are 7 to 8 projects listed on this diagram, and a few of these are already done, and a few of these are currently being reviewed, and a few of these we haven't really had the opportunity to give much attention to yet. This is an ongoing process for me, for me and Abbott, and I, as a hospital executive, feel like we've benefited greatly simply by going through this kind of organized process in order to evaluate how our lab is doing and how it should be run in order to help the hospital attain its larger objectives. So I think I will end my presentation here and join the other panelists and answer whatever questions I can. Thank you.
Thank you, Mr. Lee. It was very impressive to see how Design Hospital has built up its lab capabilities. We'll now go into the Q&A time for this session. We would like to invite the audience to ask any questions you may have in the chat box. Now let me introduce the moderator of the Q&A session, Dr. Dini Hadayani, Chief Executive Officer of Medistra Hospital. Dr. Dini, the time is yours.
Thank you, Cindy. So hi, everyone. Good afternoon from here, and depends on your time zone. That will be good morning, good afternoon, and good evening. So we have listened to Mr. Jainam and Mr. Hyun Lee presentations. I think that would be good to hear the wonderful collaborations between Design Hospital and also Abbott Laboratories. I would like to introduce both of the speakers, a little bit of them. So Mr. He is, we know, is the Chief Strategy Officer of Design Hospital, the largest private medical center in South Korea in North Jeolla Province. Hi, Mr. Hyun Lee. And then we also
Hi.
have, good afternoon. And then we also have Mr. Jay here from Abbott. So Mr. Jay is the APAC or Abbott APAC Value Creation Consulting Manager since 2019 until present. And his responsibility will be the value added projects for hospital management and also laboratory across Asia Pacific. So listen to these both presentations just now. I would like to address some questions for question and answers sessions this afternoon. So first question will go to Mr. J. Since we are creating the new smarter and efficient lab in the future, so how do you describe a future lab look like and how can we prepare for that?
Well, I think we have to take a look at the somewhat different way when we prepare the future of lab in a short term and the mid and the long terms. So it depends on the progress of the technologies. So basically what we have to take a look at this moment, we have to considering the big changes such as COVID-19 pandemic. So I think this is a really big momentum. There is a reasons why there is no one to care about in the lab importance of a lab test, right, in these days. So there is a reasons why, I think the basic thing is not a changes even in the future labs. So what I mean is that the quality. So quality is more than the volume, might be one of the things we have to take a look at in the future lab. The second thing is that data management. So as I believe, lab is one of a big domain at the hospitals where handles the big thousand amount of data at the hospitals. On that point is how we can utilize that big data as a lab point of view. This is one of our key areas we have to take a look at to prepare the future of the lab. But on top of that, we also think about the type of a test. So as we have experienced before, in the interview before, we only handling the test at the lab. But now, COVID-19 have a hugely impacted the change of a test at all. So such as a home test, even in the drive-through test, the kind of things, right? So there is a reasons why we have to take a look at what are different type of tests we have to handling in the future lab. So that is also one of the things we have to take a look at. So home test, definitely, and also in the point of care test, of course, in the gene and the molecular test, of course. So these things might be areas we need to prepare as a future lab. But on top of that, I believe more than important is infrastructures, how we can prepare. So that is a very important because we have mentioned many things about the virtual healthcare now. So on that point, how we can utilize in the virtually our lab tests. So there are a couple of hospitals in the United States, even in the Asia Pacific, they have a considering about the very simple of a test to send into the home, and then they have received it to test. So that is one of the way to improve it, their quality, but at the same time to sustain the turnaround time. I think those are kind of approaches and the effort from the hospital point of view. That is might be one of the things we do prepare for the future lab.
Okay. Thank you. So above all, that would be good because we also need the data as our platform to move forward. And now my questions goes to Mr. Lee, which is also one of the questions from the audience. So we know that this COVID situation made our laboratories more important than ever, since we have to do screening and etc. Using our lab facilities in the hospital. So what is the biggest challenge in the laboratory so far in the new normal situation, and how are you going to overcome all the challenges in Design Hospital Korea?
How am I going to overcome which challenges?
Challenges, yeah. What is the challenge, and how are you going to overcome the challenge? To have a very smart and efficient lab, especially for this COVID-19 situation.
Honestly, frankly, I think the biggest challenge now that the lab and the hospital are facing from this COVID-19 crisis is that every day is just too hectic. There isn't really enough time to sit down and go over in a formal manner what challenges we are facing, what difficulties we are having. It's more of an everyday crisis situation.
Of course.
We just need to tackle whatever problems we are having that day. So I think the biggest challenge. So to answer that question, I would say that the biggest challenge is the fact that things have just turned so much more hectic. There's no peace of mind on an everyday basis. And I think the best way, this answer might seem way too untechnical, but I think the best way to overcome the challenge has been to really just stay calm and to stay a few steps ahead. So, to be more specific, one thing that's really helped Design Hospital is because we are not located in Seoul, we are in a region. COVID-19 crisis seems to hit Seoul first and then move to other regions. So we try to learn of the cases that were happening in Seoul-based hospital first, and we would find out what they did in order to address those crises, and we would try to learn them beforehand so that when that same crisis hits Design Hospital, we are prepared.
Okay. Thank you. Very good answer.
Sure.
And the next will be for Mr. J again. So this is also a question from the audience. We have learned that this transformation requires probably a large amount of investment. So is there any period that you're looking at, to ensure there is a return on investments, or how long would it be returned?
Well, I think there are kind of things we have to take a look at, laboratory point of view. So on that point, even I have mentioned, in my slides, this is a very big opportunity, we have to take a look at in the future sites, right? So that is the reasons why I have emphasized on the alignments between the hospital and also the laboratory sites. I think that is very critical point to taking. So what is really meaning is that normally, hospital itself in the hospital arrangements sometimes have a misleading lab as using just a lab test in the some of the call center and the referral centers to align it as a standalone organizations in look like. However, lab is also very important role we can take in using as a hospitals to improve the overall hospital quality and efficiency. So in that case, is how we can utilize the lab to proceedings, to providing such a incremented, solutions towards the hospitals might be of significant importance. So that is the reasons why I believe to align between the hospitals and the laboratory strategy is a very, very critical and important. That is my thinking.
Okay. So,
Dr. Dini,
yes.
Do you mind if I add something to what Jay said?
Yes, please.
In response to that question? I'd also like to, I'd also like to emphasize to look at non-monetary factors, when you're thinking about the point of return, because there's so many important factors that are not monetary related, such as, the infection risk of your lab staff, accuracy of data. If you have to rerun a test, that can really, screw up your surgical time schedule, whatnot. So there are all these other factors that you have to take into account. So that's something that I'd like to emphasize from the hospital perspective.
Thank you. So you need to meet your patient's requirement, that's for sure. And also for safety and quality reasons. I think that would be the two main answers for, hospital management perspective. And then we also have move forward to the next questions for Mr. J. Since you are, creating a new smarter and efficient lab in the future, so there's a question from the audience is, what is the benefit of having the virtual lab? And would the point of care lab tests will be available for consumers at home soon? So this will be like, how are your future lab support at home diagnostic and virtual care? So that will be the question.
So for future labs, how we can support for the home cares in the home-based tested cares, right? Yeah, I think that's a very good question because it's kind of I believe we are in the middle of that areas that is happens by the COVID-19 pandemic, right? So in the before, we are heavily rely on the test in-house of hospitals, laboratory, but now we are think of it, some of the tests in the home test, in the virtual test. But the problem is that there's still, there are a lot of hesitations coming from the consumer side due to the quality and the TAT matters. So what I mean is the quality is still in the quality and home test is somewhat behind of a test in the in-house of laboratory. The other thing is the TAT. Even we think of it as somewhat quick test. However, this is also very compromising the quality side as well. So there's a reasons why acceptance of patients might be a biggest challenge. So to look over the home test at the, to equip as one of the asset of a hospital point of view, to prepare for the long-term strategy as a laboratory size. So if we can overcome this kind of challenge, such as quality and the TAT, so in that case, it might be I totally agree with that. The home test might be can be one of the other assets to protect our patients from the disease in terms of diagnosis in the future, definitely.
Okay. So thank you. And again, maybe this is going to be the last questions before we conclude. So what is the preparation for you, both for hospital and also for laboratory, to keep up with COVID-19 mutations? Because I know that, this virus is always mutate to the new level and new kind of viruses. So how are you going to prepare for that from the laboratory perspective and also from the hospital perspective? Okay, Mr. J first.
Oh, yes. I think this is a kind of a burden. We have a lot of violence, due to the COVID-19, right? I think that is a kind of a reasons behind. So I think that we can see of that violence, we can see some different two directions. One is what industry can prepare, and the other thing is what hospital can prepare. Right? Industry-wise, there might be a very accelerated the speed of the preparing the vaccine to against that violence happens in the public, of course. So that is a kind of one of a way. However, at the same time, from the hospital point of view, they need to improve their efficiency and also speed up to finish all of the tests within a given times. I think that is the thing. The overall thing is that how we can handle such a virus. The best way, what I heard from the WHO in this thing is that the wear the mask. So I think that is the kind of things we have to take. We have to think of it to protect the virus of COVID-19 successfully, and also properly from my point of view.
Okay, so are you having new reagent or new equipment, for screening, for COVID-19 screening, probably?
Oh yes, we have it. Our point of view, we have several things definitely. Not only for the molecular science and also antigen and antibody, and also in some of the tests in the IgG and the IgM we have it in the market. Mm-hmm. So this is a kind of a very well portfolio we have prepared for handling this kind of test at the inside of hospital, even outside of a hospital as well.
Okay. So from Mr. Hyun Lee, are your hospital ready for the new mutations from the virus so far?
We are trying to be ready. What worries me most about mutations is that it can very suddenly create a large increase in the number of COVID-19 cases that we have to treat and the number of tests that we have to run. And that can, and the rate at which that happens is so much faster than the time that we have to prepare for such a change. So that's been very challenging. But is there a way to, are there a few good answers that I can give as solution to those problems? I do not think so.
Okay. I think we're reaching out.
Other than the obvious answers, such as getting the equipment ready in place beforehand, getting the personnel ready beforehand in place, but those are not as easily done as said, because they have their associated costs.
Yeah, of course. Okay, so thank you, everyone. It's a very good sharing, a great learning from each and every one of you. I know that when we're, creating a future-ready lab, which is going to be smarter and efficient based on our platform in a hospital, not only we're going to be ready for the lab instead, we're also going to be ready for the COVID-19 management and the laboratory risk at the hospital wide. So thank you again for a very good sessions, and wishing you all a good afternoon.
Thank you, Mr. Nam, Mr. Lee, and Dr. Dini for the discussion, which has given us all food for thought about the role that labs can play in healthcare. We'll now take a short break, and when we are back, we'll have our next panel discussion on the role of digital in improving accessibility of care. See you at 3 p.m.